Hey, Mark, it's nice to meet you.
Hi, Robert. It's nice to meet you as well.
Great. Thank you for coming on to the Agility Z vlog and just kind of sharing your background, your experiences in IT, and motivating other people to get into IT. And so that's what this is about. So let's start with this. Could you tell us about your background?
Sure. My name is Mark Vragovic. I'm actually a pharmacist by trade. I went to Purdue University, got my PharmD there in 2010, and worked as a clinical pharmacist in institutional pharmacy, hospital pharmacy, usually acute care hospitals, 200-300 beds, thereabouts. Some all inpatient, some like centralized, some decentralized clinical pharmacy, a lot of operational logistical types of things, and then also patient education, multidisciplinary rounds, things like that. I did that for about 8 years. My family and I bounced back and forth across the country a few times. And when we were moving back to Florida, where I'm now based in the Tampa Bay area, I was looking for a gig, and there's an IT pharmacist position available at Johns Hopkins All Children's in St. Petersburg. When I looked into the job originally, it would have been a change for me, always being in the clinical space. But while I was working as a pharmacist, I was always engaged with new systems, new technology. Anytime there was something new being implemented in the pharmacy space, I found myself volunteering to be a super user. So I thought I knew a little bit about technology. I found out later that I didn't. But that's what drove me to consider this position. It was available at a reputable organization, and it was a change that I thought I was comfortable making at the time. I spent only about a year there and learned a lot about the IT space because I moved completely out of the clinical space into the IT space. My clinical background was used very heavily there to help essentially validate the work that was being done, building and maintaining the electronic health record. And I was lucky enough that there was a consultant there at the time who spent quite a bit of time with me each day, about 3 hours a day, Monday through Thursday, training me on some of the nitty gritty of the EHR and how these things work, specifically for Cerner. And so when he actually moved on to Moffitt Cancer Center and called me one day and said, "Mark, these guys need you here on this team." So I was very lucky to have met Tom, and he told me there was a position available. I interviewed, and that's where I've been since. Now I've been at Moffitt Cancer Center for about 4 years, working as an informatics pharmacist. I work in the space between the clinicians and the more technical people. I am more technical than most of my colleagues, certainly in my clinical colleagues, more technically adept, I guess, but I don't build and maintain the system from the back end. So that's who I interface with, essentially, is helping with translating, but also helping with designing, helping with training, all of that kind of thing. So that's now where I've been. I've now, I guess, been in IT for a little over 5 years, and that's a little bit about me.
Wow, that's very, very impressive. Like, I have a question about the pharmacy IT sector. Like, do you feel like there's a big demand for that?
There is, and I think like anything else in IT, while there are similarities everywhere, every IT job is a little bit different. I think right now, an absolutely explosive space is healthcare IT, absolutely explosive, and the technology advances. I mean, in all aspects, of course, my area is pharmacy. That's what I'm most familiar with. I'm getting exposure to a lot of other things and learning, but in the pharmacy space, it seems like the technology is really just going leaps and bounds. So there's a lot of opportunity, I think, for people with clinical backgrounds to become who maybe have a technical leaning to become involved in that. It goes both ways. I work with technical people that don't have a healthcare background, and they do very well. So we're all essentially cross-pollinating, cross-training, but there is a real need, I think, for folks with a clinical background to move into the IT space, especially in pharmacy. generally, pharmacy informatics type jobs tend to be automation based, whether it's automated dispensing cabinets or IV workflow solutions, things that are downstream from the electronic health record. So order information, patient information is sent from our EHR to these downstream systems that help perform tasks like sterile compounding or pre-packaging or any of those types of activities that help with the operations in the hospital. My team actually is not involved with any downstream automation. So to be clear, I don't know that we have like a typical pharmacy informatics experience because we're at a specialized cancer center, and my team actually owns the electronic order sets that are for chemotherapy treatments, and they're very complex. And so that's one of our primary roles, is to own the design and maintenance of those plans, keeping up with that. In addition to sort of general meds process in EHR. So we tend not to be very involved with the downstream automation, but we have to consider it. So, but yes, I think there are lots of opportunities and varied opportunities in the healthcare IT space.
Okay. So could you tell us some about, like, what do you like about what you do?
I enjoy the problem solving aspects of my job. I wouldn't say that every day is different, because sometimes it does feel like every day is the same. But we definitely have a mixture, essentially, of task-based work and project-based work. So when I was working as a pharmacist, my environment was an entirely task-based environment, whether I was working clinical decentralized pharmacy, taking care of patients and working with the docs, or whether I was centralized, working with making sure that the operation of the pharmacy was going, make sure compounding was done, pre-packing was done, that the machines were full, that we had what we needed. So to go from everything that I do takes 3 minutes or less, and I do 1 million of them a day, to suddenly now I have to maintain focus on projects that can last months and years, but I also have my daily tasks. That to me is good. It's a good mix. I love the schedule. This is not true for all people in IT, but I actually went from being on call, working rotating shifts, working weekends and evenings and days, to now in my IT role, I've been Monday through Friday, sort of, what you would think of as regular work hours ever since. For me, that's been a major benefit. I've been doing it for 5 years. I have a 7-year-old daughter. I've been able to do evenings and weekends at home. That's been a major benefit for me.
Okay. So do you work from home typically, or do you go into office?
Both, actually. So
Hybrid.
when I was, before in the before times, right? Before COVID, I was in the office. The expectation that I was that I would be in the office, and we have my team, the 4 of us. We have an office in the basement around the corner from the pharmacy department in the main hospital there, and so that's very functional and practical for us. But the reality is that a lot of our work can be done sort of from wherever. We do a lot of customer facing work. A lot of that can be done via Zoom, via phone, and that's something we've learned to do very well. So during the pandemic, the technology improved. We all know that, right? Zoom, Teams, whatever they might be, video conferencing functions better now than it did 3 years ago. I think we all have to agree that that's the case, and we're lucky that the technology is functioning as well as it is. If this had happened 10 or 15 years ago, life would have been different for the past 3 years. But because the technology allowed for it, we were able to take advantage of things like Zoom. We do use Zoom at Moffitt, and be able to do that work and still interact with our customers, still interact with the technical folks that we're working on tasks and projects with. So now in the past, I would say 9 months or so, we've been working more of a hybrid model where we're in the office a few days, working from home a few days. We've become more flexible. We've become more available, more accessible, and a little bit more, it's more convenient certainly for us. The flexibility is great. The flexibility is great, and the work gets done. And I think a lot of people around the country are learning that people don't have to be at their desks to be doing their job. They just have to be motivated, and they have to have the tools they need. So.
Yep. And like how things are going now, what I'm hearing is there are a lot of organizations that are starting to say, hey, we want our people to go back in the office. Have you heard anything about that?
Oh, sure. I mean, we have a push there with us as well. And I think, even I think executives at some major tech companies are saying, people are going to be back in the office. It's a matter of time.
Right.
I agree that when I'm in the office with my team, there is an energy there that we can't necessarily harness in the same way when we're on a video chat. But I would also say that we can harness energy. It may not be the same, but we can work together to problem solve. We can, honestly, when we're in the office together, we get on a Zoom meeting so that we can share screens with each other more conveniently. So we've learned to use those tools in such a way that it's kind of hard not to use certain aspects of a teleconference or video conference, right? It's much easier than everybody scooting around one person's computer with their chairs and leaning in when I can just share my screen and we can just talk. So while I agree that there are benefits to being in person in the office, relationship building, being aware of your team. I'm a leader as well, and I have a small team, but I can understand from a leadership perspective why it would be nice to be able to walk around, say hi. There's value in that. There is, but not so much value that you can't also consider that most staff level employees want the flexibility. The leaders want it as well. They won't admit it. But the staff level employees, they want the flexibility and they can work with it. Part of it is trust, part of it is professionalism. There's always going to be one person that ruins it for everybody else, right? But when you're working with a team of professionals, 80-20 rule, that people are going to be able to handle it. And what you do is you set certain expectations, you follow up, you make sure that people have what they need, that they're and that they're motivated, and then you don't have to spot check, right? Hey, I see that you're not at your desk. I'm not worried because the work's getting done because I'm interacting with my employees in some other way. Maybe it's a 15-minute checkup on Zoom. There's nothing wrong with that, in my opinion.
Right. Yeah, and that's really like an interesting topic because so many people are like, well, I feel like working from home, the productivity is still the same as going into office, and they feel like they have a better work-life balance. But then you have on the other side, people that believe in the hybrid model of, okay, we need that relationship building opportunity. So it's good to be in office. And so I guess you can just look at it kind of both ways, and maybe it's more specific to the organization or the type of projects that you're working on.
I agree. I think part of it is also, understanding the roles of the people who are working with you and for you. Part of what we need to do as informaticists, at least at Moffitt, the way our role is designed there is I need to be able to walk through those departments on occasion and watch what's happening or hang out a little bit and ask, how are things? There's some value to that as well. Going to my end users, my customers, and saying, how is it going? Or how was that most recent change working out for all of you? There is value in that. Absolutely. And when it's time for me to go walk through the department, I can put on my shoes, I can get in my car, and I can go to Moffitt and I can walk through the department.
Right.
And so, it does matter what you do. And, there have been a lot of people across the country for the past 3 years that have had to go to work every day in a risky environment. It's important that we don't, take certain things for granted. Some jobs you can't do from home. But then if we really are trying to mitigate risk down the road of let's just say contagious diseases, because that's something we all think about nowadays. You could also think about it in terms of climate change or congestion in general. I know that in St. Petersburg, and Tampa Bay, we have terrible traffic We have terrible traffic. Let some people stay home. Public transportation would be nice too, but let some people stay home
Yeah.
that don't have to be. And you can mitigate certain risks that way as well. That's a bigger question, of course.
Yeah. Yep. Definitely true. So I have another question. So about your current position, so you previously were a pharmacist and now you're in the informatics space of pharmacy. Do you feel like the salary was worth it as far as like going from being a pharmacist to what you're doing now?
Sure.
Is the salary improved, or what do you think?
What I would say is that I am still primarily first, I'm a pharmacist. That's something that I can't shake.
Okay.
Also, my job requires that I'm a licensed pharmacist. And so then I think it's important for me to call that out, right? I am not all jobs in IT, certainly not all jobs in healthcare IT require you to be a licensed healthcare professional. So that is a very important consideration when you're
Interesting.
thinking about salary, right? So I would tell you that based on how I'm compensated as a pharmacist in IT, it's very similar to if I was working in the pharmacy department as a clinical specialist, as like clinically advanced, someone with some extra I shouldn't say letters after their name because I'm just struggling to find the word. Credentials, excuse me so much. People with extra credentials who are doing more specialized work, we're compensated at a similar level as they are. So what I would say is that to me, that makes sense because again, my role, I still feel like I'm working first as a pharmacist, and I look at problems that way. That's what the organization needs out of me, is that experience in the IT space, and then I'm compensated that way. But the bigger question is, what if it was an IT position where I didn't need to be a licensed pharmacist, and the compensation would be different, and I would have to consider that. For me personally, I would say that pharmacists who want to move into the IT space can find positions where the salary meets or exceeds what they were getting in the pharmacy. I think I don't want to, I'm going to speak for them because I'm here, but my pharmacy technician colleagues who work very hard and are very skilled and are unfortunately unpaid in the clinical space have found great success in drastically improving their compensation by moving into IT, by taking their skills and moving into IT. So I would say that in the pharmacy space, while with the pharmacists, it's maybe a level or a gentle bump, the technicians can see a real opportunity there to improve their compensation moving into the IT space.
Interesting. Okay. Thank you for that. So even getting into this space, what were some of the challenges? Because, we all know that you faced some challenges making the transition, or not transition, but just adding on to what you're already doing.
No, I agree. And for me, the big challenge was it was a moment. I had moved down to Florida. We brought my wife's grandma with us. I bought a house on the internet. I had never seen it. My wife walked through it once. It's got a mother-in-law suite attached. It's perfect for grandma. I don't love the house. I've learned to love the house. Anyway, so here's my life, right? And then I walk into my first division meeting. It was the whole IT division. The chief information officer, the CIO, was leading the meeting. So that's the type of meeting that it was. And I was listening to the managers and directors of all the other areas report out. And we're talking about clinical systems teams like mine, pharmacy and ancillary radiology, but also the other EHR teams speaking about those aspects of clinical systems that I maybe almost understood, but realized in that moment I didn't. But it was also the infrastructure folks. It was the cybersecurity folks. It was everyone was reporting out. And I knew that I had no idea what was going on, that I had a lot to learn. And here I was, 8 years out of school, 8 years out of 16 years of school, and suddenly lost. That was terrifying for me. But I learned fast, and that's what people do. People that are drawn to to the IT and to the tech space generally tend to be more flexible and willing to learn, maybe, I think. You know, you have certainly a motivation. You want to know how to do your job. And then I was also lucky to have people on the job that were willing to take the time and were able to take the time to help train me. For me, the biggest challenge was overcoming that terror of suddenly not knowing what to do. Because like they say, it takes 10,000 hours to become an expert at something. Yep. So that's about 5 years, right? And so I had been a clinical pharmacist in institutional pharmacy in acute care hospitals about the same size for about 7.5 years. I knew exactly what I was doing at all times. I knew exactly what I was doing. And I was not the best clinician in any of the places where I worked, not by a long shot. There were always people who had stronger clinical chops than I did, but I was also efficient. People would look for me and ask for me and be happy to see me, whether it was nurses, other pharmacists, providers on the floor. I knew that they appreciated my efforts and thought I was good at my job. I also thought I was pretty good at my job. So to transition from that into really not having a clue what I was doing was a big challenge for me, a big challenge. I was lucky to have external motivations as well. My sister, who graduated with an English degree from Indiana University and then was working a lot of copy editing in she had some cool jobs. She had one at Chicago Magazine, which was a cool job for a while, but then she was working as a copy editor for Northwestern Mutual something, an insurance company. And she was doing copy editing of insurance plans. You can only imagine what a brain deadening job. You're from finance. You know how dense things can be. You know how dense words can be. And so she was like, that's it. She went to dev boot camp and now she's a coder. And if you use Home Chef, you know, you might have heard of Home Chef, HelloFresh, Blue Apron, some of these. But if you use Home Chef and you go and you pick your menu and you put it in a little shopping cart, my sister does the coding behind some of that. So she's working in a totally different job. And I had that motivation, seeing her uproot herself professionally, quit her job to pay tuition for 3 months, not knowing what was going to come out of the end of it, and be very successful. I saw that example. So that challenged me to go ahead and shake off the bad feelings and figure it out. And I feel like I have. I'm feeling more comfortable in my job today than certainly I did then. Here we are 5 years out. I wouldn't call myself an expert.
But I mean, you actually are an expert. I mean, what you've done already is really commendable, and you're making an impact in pharmacy from a different angle as well. So that's, very monumental. And that brings me to my next question. Like, where do you see yourself in the next 5 years?
I wouldn't give this piece of advice to somebody necessarily to say that, wouldn't it be great if 5 years from now you were in exactly the same place? But I'll be honest, I lead the pharmacy informatics team at Moffitt Cancer Center. And if I could be here 10 years from now, I think that would be great. The organization has a lot to, it's a fantastic organization to work for, but the work itself, I should say I do have a great team. I really like my team, and it helps to like the people that you work with. It really does. But the work that we're doing, we see the benefit. And sometimes it's subtle and sometimes it's in your face. When I interviewed for the job, there was the supervisor level of the interview. The heme clinical supervisor and the BMT clinical supervisor were there, and we were chatting. And I remember Rebecca, the heme supervisor, saying, you know, IT is kind of where our ideas go to die. And I would have to say that in healthcare, because the IT space doesn't move quite as quickly as in other areas, I would say that healthcare IT tends to be a little bit more conservative because they have to be. They have to have tried and true. We're talking about patient information. We're talking about healthcare outcomes. They don't want to be on the bleeding edge of technology. They can't beta test. They can't afford to do that. What they have to be standing on a solid foundation. And then there's just a lot of regulation around it. So you have to be careful how quickly you move and what you change, because there's certain things that are required that you can't get away from. There's a lot of factors. I'm oversimplifying it. But anyway, part of that is not so much that IT wasn't doing what they needed to do. It was that there was a feeling like when we have a good idea, we can't get it done. 2 years later, I was sitting in an interview for one of my teammates, and Rebecca said to this person that was interviewing, and I don't know that she meant to say it because I was there. I was one of several people in the room. She said, you know, a couple of years ago, I would have told you that IT is where things go to die. And I thought to myself, yeah, I remember you saying that. I didn't say that out loud. She said, now we seem to be getting what we need, and we want to keep that momentum. For me, that was a huge personal victory. And I don't know that it was for me necessarily, because I have a lot of good people that I work with and rely on, but I went ahead and took it as my win. And I rode that one for a while. That was the reason why I was happy for a number of days after that. To have that impact, to know that you're making that impact, to make the clinicians at the hospital have a better interaction with their EHR, because otherwise you're just fighting the system all day long. You should be able to focus on taking good care of patients. You should be able to focus on taking good care of patients. And if the EHR is functioning the way that it should, and you have the tools that you need, you're working with it, not against it. And that's ideal. So I would say that my experience so far makes me want to be here 5 years from now, maybe leading a larger team, right? We all want that.
Of course.
But hopefully close to where I am now.
Okay.